Okay, so today we're going to be talking about dental images and the dental radiographer, which is you. And this is on chapter 11 of your dental radiography textbook. So first we'll go over the learning objectives, and that is to define the key terms associated with dental images, discuss the importance of dental images, the benefits of dental images, and the knowledge and skill requirements of the dental radiographer. We'll list the use of dental images and examples of common dental conditions that may be evident on the image. We'll list the duties and responsibilities that may be assigned to the dental radiographer and discuss the professional goals of the dental radiographer. The purpose is to review the importance and benefits of dental images and the knowledge and skill requirements of you, the dental radiographer. Also to define the role of the dental radiographer and describe his or her duties and responsibilities, and to outline the professional goals that you may have. The dental radiographer must understand the importance of dental images and the reason why imaging is a necessary component of comprehensive patient care. A dental image is a two-dimensional representation of a three-dimensional object produced by the passage of an X-ray through teeth and supporting structures. The dental radiographer must be familiar with the uses of dental images, the benefits of dental images, and the information that can be found on these images. Dental images are a necessary component of comprehensive patient care. In dentistry, dental images are essential for diagnostic purposes. Images enable the dental professional to identify many conditions that may otherwise go undetected and to see many conditions that are not apparent clinically. With the use of dental images, the professional gains a great deal of information about teeth and supporting bone structures. An oral exam limits the practitioner to a knowledge of what is seen clinically, and they can't see what's underneath the surface unless a dental image is produced and viewed. So dental images have many and varied uses. One of the most important uses of the dental images is for detection of disease, lesions, and conditions of teeth and bones that cannot be identified by clinical examination alone. Dental images are also used for confirming suspected diseases and for assisting in the localization of lesions and foreign objects. They are an essential component of the patient record. An image contains a vast amount of information, more than what the written record does, and they provide the practitioner with a baseline information about the patient. And follow-up images can be compared with initial images, and the two can be examined for changes resulting from treatment, trauma, or disease. So the primary benefit of dental images is to the patient is detection of disease, as mentioned earlier. When images are properly prescribed and exposed, the benefit far outweighs the risk of a small dose of radiation. The use of dental images assists the dental professional in identifying and preventing problems such as tooth-related pain or the need for surgical procedures. So some of the information found on dental images that may produce no clinical signs or symptoms in a clinical examination alone are the following. So these are missing teeth, extra teeth, impacted teeth. Impacted means the teeth are there, but they're below the below the level of the tissue, so they can't be seen clinically. Dental caries, especially those found between the teeth. Periodontal disease. We can actually see buildup of tartar and calculus around the teeth, as well as drops in bone levels, and these would indicate periodontal disease. We can see tooth abnormalities, retained roots from possibly extractions that didn't go well, or there are some patients that have even tried to extract their own teeth and have left retained roots there. And those can be sources of infection that will need to be removed. Also cysts and tumors. So these images can be used to educate the patient about some of these common conditions that are detected only through the use of dental images. The dental radiographer is any person who positions, exposes, and processes dental X-ray image receptors. They must have a sufficient knowledge and technical skills to perform dental imaging procedures and must have a thorough understanding of his or her responsibilities and professional goals. So to be a competent dental radiographer, background knowledge of dental imaging is essential. All right. So the dental radiographer must have some basic understanding of radiation history and a working knowledge of radiation physics, radiation characteristics, radiation biology, and radiation protection. In addition, you must be familiar with the dental X-ray equipment, dental X-ray film and sensors, dental X-ray image characteristics, dental X-ray film processing, and quality assurance in the dental office. In addition to background information, the dental radiographer must master the knowledge of patient management basics. Most important, the dental radiographer must be proficient in technique concepts and technical skills used in both film-based and digital imaging. So it is important that the dental radiographer master knowledge and skills to provide good quality care. The dental auxiliary is a member of the dental team and has an important role in the practice. Each auxiliary is assigned specific duties and responsibilities that vary depending on the size and nature of the dental practice, as well as the individual qualifications. Some of these responsibilities in regard to dental imaging may include the following: positioning and exposure of dental X-ray films, processing of dental X-ray films, mounting and identification of dental images, education of patients, maintenance of darkroom facilities, as well as processing equipment, implementation and monitoring of quality control procedures, and sometimes the ordering of film and supplies. So the radiographer must have pride in his or her work. Always strive for professional improvement, have defined professional goals, and be committed to achieving those goals. Priority goals for the dental radiographer include patient and operator protection, patient education, operator competence, and efficiency and production of quality images. So the dental radiographer's professional goals should be a top priority and primary concern. And when the dental radiographer attains professional goals, the patient receives the highest quality of care possible. All right, that's all I have for this chapter. Thanks for listening, and we'll talk next time.